Australian Thyroid Foundation, which provides support for people with thyroid disorders and also provides education, wants to get the message out that we are not doing enough testing for people for thyroid disorders and we're missing a lot of patients. Now, we estimate that there are over 1 million people in Australia who have a thyroid disorder that are not yet been diagnosed and therefore not treated. So if you don't think of it, you don't test for it, and you don't diagnose. So we need to get our patients to be going along to the doctor and saying, do I have a thyroid problem? And for the doctor to be responding by using the appropriate tests. Now, there are two situations where I think we need to emphasise. And the first situation is pregnancy. Testing, all women, in my view, should be tested, pregnant women should be tested within the first month or so of pregnancy. The sooner they're tested, the better, because if they have an underactive thyroid during that time and it's not picked up, then the consequences are either potentially loss of the pregnancy or intellectual disability, loss of IQ in the offspring. So it must be picked up early and must be treated early. So it's important that all women are tested. If a woman has a family history of thyroid disorders or previous history of having suffered from a thyroid problem, then of course this should be tested before she becomes pregnant. The second issue with pregnancy is to ensure that women get enough iodine in their diet. We know from studies done in Australia that iodine intake in pregnancy is by and large insufficient. So we should educate all of our women of reproductive age about the importance of having enough iodine in their diet, and we should ensure that all pregnant women do take an iodine supplement. Now, the other time of life we should emphasise is the elderly. Hypothyroidism presents slowly, oftentimes with subtle symptoms and very few clinical signs. So if you don't think about hypothyroidism in the elderly, you won't diagnose it. So if patients come along with vague histories of changes in their memory, their loss of intellectual ability, and doing the normal things they do in life, problems with their weight, their skin, and so on, a whole host of symptoms that are vague, that always think this could be due to hypothyroidism. So you should exclude it by testing. It's almost impossible to exclude it by a clinical examination because the signs are often so soft or so subtle. You must test and to ensure they don't have hypothyroidism. So if I can leave you with the messages for testing, and that is to ensure that all pregnant women are tested and tested early in pregnancy and treated if necessary, and that again, the other time of life we should think about is the ageing population, often with vague symptoms and signs. Think of hypothyroidism, test for it, and if you diagnose it, treat it. Thank you.